Right, okay. This is a second in a series of videos talking about clozapine and schizophrenia. This time I wanted to focus about the side effects. I mentioned already that clozapine has anticholinergic efficacy and hence anticholinergic side effects, which affect the parasympathicus. This can be constipation, dry mouth, blurred vision, and difficulty passing urine. There are anti-adrenergic effects, which can cause hypotension and sexual dysfunction. Other side effects can cause sedation, weight gain, usually by increasing the appetite, and people can develop diabetes, nausea and vomiting, ECG changes, possibly a delay in the QTC time, headaches, fatigue is very common, hypersalivation, tachycardia, hypertension, drowsiness, and dizziness. So these are the common side effects, and the patients should know about that. Less common is gastric discomfort, fainting, small involuntary muscle contractions, enuresis, and nocturnal enuresis. Periodic catalepsy, I've hardly seen this, but I would say this is one of the more rarer side effects in my personal view. There's other more rare effects as well, which can be life-threatening, which disturbed temperature regulation. People can have fever. Hepatitis can be caused, jaundice, pancreatitis. The reason why it was withdrawn at some point in time was the agranulocytosis, which can cause leukopenia, eosinophilia, leukocytosis. So one says that the risk of fatal agranulocytosis is 1 in 4,200 patients. I would say hopefully that's a bit less. Some people have thrombocytopenia. So in this case, one, as in other cases, one would withdraw the medication. Dysphagia is not uncommon. There are vascular problems, arrhythmias. So clozapine can in fact affect the heart, cause cardiomyopathy, pericarditis, pericardial effusion, and thromboembolism. So tachycardia might be a problem, an early sign. And there are risk of death. Pulmonary embolism is one problem as well. Confusion, delirium, and restlessness. Agitation can be caused. And already mentioned diabetes, hypertriglyceridemia, hypertriglyceridemia. Anyway, that's a good one. I usually have some problems pronouncing properly in English words which have the same printing, the same spelling, but different pronunciation in German. I'm very sorry for this, but anyway. Yeah, intestinal obstruction and ileus can be a problem. Hepatic necrosis and enlarged parotid glands. Priapisms, skin reactions, nephritis are not unreported, but usually there are case reports, and malignant syndrome might be a problem. However, in total, usually clozapine reduces the mortality in schizophrenia, even though it has so many of these side effects, due to the fact that more or less it reduces one of the main problems, which is suicide in schizophrenia. In case of any of these side effects, you can usually try to deal with some of this. So if people have constipation, you can try them to have a high fiber diet, sufficient fluid takes, and maybe some laxatives. In case of fever, you can try some symptomatic relief and try to find for sources of infection. Hypersalivation can be quite nasty, especially in the night when people have their cushions and which get wet. And in this case, hyoscine hydrobromide can be very helpful. Hypertension should be checked closely. And in case of problems, one has to reduce the medication. One can take a beta blocker, but that has to be discussed with the medic and the GP to see which side effects might be a problem. Usually hypotension can be a problem, dizziness, or one would have to change a bit, the behavior, not giving up too quickly and knowing about the side effects. If there's nausea, one could consider an antiemetic. However, that's usually a bit of a problem. In case of neutropenia or agranulocytosis or thrombocytopenia, I would possibly stop the clozapine straight away. Nocturnal enuresis is a problem which is underreported. We have published a paper on that. And in this case, one can try to avoid foods and drinks in the evening. Sedation is a problem, and in case it's too much, one has to, or one can try to divide or give more of the medication at night, just to make sure that daytime sedation is not too bad. In case of seizures, which can happen in clozapine, one tries to take the medication off for a while. But then you have to see what's the risk and the benefits. Weight gain is a problem due to increased appetite, and in case of major problem, it can cause diabetes. So these are the most common side effects. Possibly haven't mentioned all of them. In case of side effects, you usually should discuss it with the GP, and this talk can only give you a little bit of an overview for people who want to know something about this medication in schizophrenia. Right, okay, that's me, and thanks for listening. And if you're interested in having regular updates on mental health problems and their treatment, please don't hesitate to register